You know, we try to make 3+U a bright spot in your day, get you feeling better, whether it's mentally about the community that we call home or often physically with different doctors' offices that are present on the show. Well, this morning it's Dr. Sean Jones's turn to be back on with Chattanooga Wellness. Good to see you.
Great to see you, Julie. I always love being here.
You wanted to kind of highlight the fact this morning that we'll talk about all the things that you do in the office, but you are here every month, which means people watching have a chance to feel like they know you. You actually
and
had
you
a
too.
lady,
Yeah,
and me too.
both of us. You know.
So you had a patient. We won't get into her specifics, but she had seen you for a while on here.
Yeah,
and called you.
yeah. You know, this is so common. When people, we have the best neuropathy program out there, and so she's been watching us for 2 years talk about neuropathy, and then bringing the shockwave machine in and stuff. We'll talk about. And she came in and she signed up and bought her package Monday. Already she's feeling so much better the first 2 treatments we did.
Wow.
And she finally came in and she spent the $49 to get the evaluation and a full treatment. And she said, wow, I wish I wouldn't have waited the 2 years. She said, tell Julie thank you. I've been watching you and watching you and watching you. And I said, I got to do this because I'm just getting worse.
Well,
and
I think
she's already responded.
It's a big deal for people, and I'll let you get into the specifics about what you do with the neuropathy and the K laser. But I think when you're not hurting, it's real easy to say, this is what I would do if I was hurting. When you do find yourself with a problem, you don't want to make the situation worse. So sometimes you can just kind of freeze.
Yeah, and the problem is as it progresses, people start to lose balance, and then they fall down and get other injuries, and
that's a good
other
point.
problems happen. And so the sooner we get it, like I've got another client who's been a patient for quite a while. We did the evaluation, and she was at just under 25%. So we don't even do the full program. We just
Wait, what does that mean, under 25%?
We check how much sensory loss you have. We measure 8 different sensations.
Okay.
And by that exam, we determine the level of care that you need. Now in her case, she doesn't need the full neuropathy package. She doesn't need shockwave. We're just going to be doing laser, chiropractic care, and some nutrition with her, and that's it.
Okay.
And she should respond really well.
When you talk about the nutrition, I know you and I have not rehearsed this, so it's possible I'm going to jump you all around.
No, you're okay.
But when you talk about the nutrition side of the things that you do, is it because if you're dealing with a neuropathy issue or something, it's the cells that need to get stronger to fix the problem, but if they don't have the energy they need, they can't get stronger? Is that
in general? But what a lot of it is too is a decrease in nitrous oxide in your tissues. We can't really measure that, so we measure the oxygen levels. That gives us kind of an indication of what nitrous oxide is like.
Okay.
And of course the 3 causes, number 1 is chemotherapy, number 2 is surgery, like knee, hip, back surgery. You get a blood flow decrease from that. Or number 3 is the old one, which is diabetes.
Okay.
And then a lot of patients are idiopathic. They just have it and there was no other reason for it.
it being neuropathy?
It being neuropathy, yeah.
You know, you kind of gloss over something that you've said before, and you see it all the time, so you forget to maybe highlight it.
Oh, yeah.
But that is that you've shared with us that the neuropathy, the most common patient coming in for help with it now is one who's gone through chemotherapy.
Yeah, you know, you survive cancer, and then you have these problems, and that's the most common problem now. That's the number 1 cause of neuropathy, and so we go in there and we can reverse that, and it's so satisfying. By the way, when patients come in, I tell them, "Did you ask any other patients how they're doing?" "No." "Well, I would." You know, I mean, you're going to come in.
Yeah, testimonials are great.
I'll bring a patient in and say, "Tell them how you're doing so far." You know, because I'd want to know that too. We treat people real in our offices.
So when you're treating the neuropathy, are you doing that with this K laser, or is it its own treatment?
Yeah, we put everything together because what we want to do is get it intense, get it moving good. I tell patients, it's like on the old Johnny Carson show.
Yeah.
He had that guy spin the plates. You know, and I get caught up in that. I think this is stupid. And 30 seconds later, I'm yelling, "Hurry, hurry!" It's the same thing. If we put a lot of effort in the beginning and really get it moving forwards good, then we start cutting back, and all you got to do is tap it and keep it good the rest of your life. So you're not in pain the rest of your life. That's our whole goal.
So I'm not going to pry at all, but you've been on, I'm going to try not to pry, but you have been on the show over the years, and you'll talk about your own personal experiences and your brother who had some issues. So
he's had so many issues, and he's done so well with the shockwave and with the K laser. And
well, I bring that up because do you feel like that gives you a different perspective to bring in working with your patients because you understand what it is to either have a fear or have the pain?
Oh, absolutely. You know, and that's what brought stem cell therapy or regenerative cell therapy into our office. We do that also because my brother was really in so much pain, he was ready to commit suicide back 3 years ago. He couldn't take the pain. And by doing K laser, the shockwave, and doing regenerative cell therapy injections with him, he's a whole new person. In fact, we're talking about him coming back in practice after all this time now. He's finally fully recovered, and I'd be happy to have him come back in with me.
Well, and it's been a long journey for him, and there are plenty of people watching who When you are not feeling good, even a week's delay is endless feeling.
Exactly.
Much less if you're somebody who's been struggling with something for years. And
Exactly.
you hear people say, well, it can get better, there's hope. That's hard to believe sometimes. So
Yeah.
to hear that your brother has success is great.
And you know what's so satisfying for I got a great staff, and my wife is just a sweetheart. You've met Carrie before, and they love seeing our patients get better. I love it too. Look, at this point in my life, I'm 60 years old, believe it or not, right?
Right.
And what else is there in life? Getting people feeling better makes me feel fulfilled as a practitioner.
Right.
And so when you come in, look, I don't want you to spend money if you're not going to get well, okay? But I want you to spend the money if you're going to get results in the proper care you need. And that's why we evaluate you first for $49. You come in and you get the full treatment and stuff. During the program, we do 3 shock waves. Treatments during our program, because that's really shortened the program and sped up the healing time.
Okay.
Shockwave does the opposite of laser. Laser decreases pain, decreases swelling, increases blood flow, and super heals tissue like it did on my brother, because it makes your mitochondria start to supercharge. And that's your powerhouses in all your cells. And that's why his nerves reattached in 10 days instead of 5 months when he cut his arm real bad. He was moved in 10 days, and the surgeon said it'd be 5 months. It just super heals. The shockwave is the exact opposite. It actually uses powerful sound waves to tear down adhesions, post-surgical tissue, scar tissue, any injuries like that. I've got a new patient started yesterday on Monday with just shockwave. He's having terrible back pain and tight hamstrings. And in the first treatment, he got up and he's able to almost touch the floor. He's feeling great. He's got a second treatment today. Because shockwave is something we do standalone also. We can do just shockwave therapy and help knee replacements that are having problems, help like my in-laws I'm doing on. Not just neuropathy, but all kind of problems.
And when people come to you, can they come in and like just experience one treatment, or do they have to sign up for a series?
Well, that's why we do the $49. You come in, you get a full evaluation. I also go through and check your entire muscle chain, all the way down your arm to the fingers or the leg to the feet. All your muscles, I reset them with my little pocket laser I carry around with me, and reset all those muscle strengths, get them strong. Do the full treatment, do the massage chair, the vibration therapy, do of course, the K-laser treatment on it, and then, of course, adjust the extremities and adjust the spine, depending on what their limitations are from surgeries and stuff. But at least clear the nerve interference. What we find, the reason why we get such great results is you have to treat where the nerve starts in the low back coming out and in the feet, not just the feet. That's why podiatrists aren't allowed to treat up higher, and that's why they can't get the same results we can with laser, because they can't treat the beginning. They can only treat the end of the nerve.
Gotcha.
We treat both ends, and by doing that, we get tremendous results with it. And it's so satisfying to see people get better, man. I've had my own health issues lately a little bit, and that's why I got this beard going on, and I'm just blessed that I can still be out there and helping people, and I'm excited about that.
So he's got 2 locations to make it easier for you to call his office and find the one that's best suited for you. In East Brainerd, the number is 643-2277. In Cleveland, it's 790-5000. You can
spend the $49 and get your evaluation and treatment and try it out.
And I know we kind of, as default, will often use the ChattanoogaChiropractic.com, but which one do you want us to kind of send people to today?
LaserAwayPain.com.
LaserAwayPain.com. All of it will take you to the same place, though, which is his office.
Yes, ma'am.
Always good to see you.
Great to see you, Julie.